Hi, we're going to begin a discussion on infections and immunity. Infections are caused by pathogens, and a pathogen is something that generates an immune response. We're going to go to giantmicrobes.com and look at their pathogens. The top row, we have viral infections, such as the rhinovirus, the common cold, and then what Giant Microbes folks put together in what they call their modern plague pack, which includes Zika virus, the flu virus, Ebola virus, and the coronavirus. The second row are bacterial infections, which include the clap or gonorrhea, salmonella, and the bottom row are pathogens known as parasites, which include giardia, heartworm, diarrhea, and malaria. So these are three different categories of pathogens: viruses, bacteria, and parasitic worms. Ugh. Let's look at what our body does in response to being exposed to these pathogens. What is that immune response that's being generated? An overview of our body's defenses include the first line of defense, which are physical and chemical barriers. Our second line of defense, which is our innate immune response. It's non-specific. It's what we're born with. It's also temporary. These include specialized white cells, such as phagocytes. Phage means eating. NK cells, which are natural killer cells. Macrophages, macro means large, and there's that PHAGE again, which means eaters, and a lot more. And our third line of defense is our adaptive immune response. This is a specific immune response. It's acquired, meaning it develops after birth, and involves T cells, B cells, and antibodies. We're going to go over these many times. So first we have our physical and chemical barriers. These include our skin. Your skin is your largest organ that protects you against infection. Tears wash away something that might get into your eyes. Cilia are tiny hairs that line your nose and your throat. We have the acid in our stomach, the pH of which is similar to battery acid, so that if you swallow something, hopefully the acid in your stomach will kill it before it has a chance to harm you. Normal bacteria, our body is loaded with healthy bacteria, and we like to use these healthy bacteria to crowd out any pathogenic bacteria that might be trying to breach this first line of defense. After this first line of defense, if those pathogens have breached the barrier of that first line of defense, if it's gotten through those physical and chemical barriers, then we have the innate immune response and the adaptive immune response. The innate or inborn immune response, it's what we're born with, includes what are called pyrogens that generate pyromaniac, heat. These cause fever. Fever is an immune response to a pathogen. We have what are called natural killer cells, macrophages, neutrophils, also known as pus, leukocytes, white blood cells, and dendritic cells. We'll talk about how it's the dendritic cells that have these spiky parts of them that will take a piece of the pathogen and present it to our adaptive immune system, looking for that specific, that's the adaptive immune response. It's very specific. And we have in our adaptive immune response very specific cells for a specific pathogen. And these are lymphocytes that are T cells and B cells. So we have the innate immune response, which is non-specific, and we have the adaptive immune response, which is very specific. Once a pathogen enters the body, once it has breached that first line of defense, one of the first responses is for those macrophages to engulf it. And once that happens, they release cytokines. Cyto means cell, kine means chemicals. These cell chemicals that attract the dendritic cells, that attract neutrophils, and attract more macrophages. Inflammation is also part of your innate immune response. When you step on a thumbtack or you get a splinter, one of your immune responses is inflammation. This is on the outside of the body. When we talk about heart disease, we'll talk about inflammation on the inside of the body. Anyway, this inflammatory response is characterized by redness, swelling, warmth, and pain, which are signals that basically say, get off this foot that has stepped on a thumbtack and get it out of here.